Welcome, folks. It's another day of Mr. Worldwide, Patrick Dells.
Yes.
Good morning, sir. How are
Morning.
you?
Hi, Mike. How you doing, man?
I'm good. I'm good.
I thought it was Stevie Wonder for a while.
Yeah, with your shades.
Yeah. No, green is hot with the sun, so you have to do dark glasses.
Okay.
It's important. Yeah, man. So how you going, man?
I'm good, man.
I'm tired, man.
Yeah.
Tired,
The last time you were here, we spoke a lot about men's reproductive system and men's health and women's health and so on.
Mm-hmm.
So many people called, and in particular men, they were so concerned.
Yeah, well, they should be concerned because a lot of women crying out.
Yeah.
And one came to me, a couple came to me here still already. And the
Yeah.
woman told me straight, she said, if he can't stop homicide, I will kill it for him. You know, and it's a problem that affecting a lot of young brothers too. So you know that we have to educate our people about keeping the reproductive system healthy, especially women too. Because our sisters, our princesses and empresses, we call our black women, is full of fibroids, full of it. And lots of women are losing their uterus to that.
Yeah.
So then we're going to have a program on that, and we're going to teach them how to take care of the uterus. Another condition that is affecting lots of women, again, is also yeast infections, chlamydia, and PID. And because yeast lead to that, to PID. You know what I mean? And when a woman keep on having a recurrence of these infections, it causes her to have pelvic inflammatory disease long term. Start to get back pain, and she start to get a lot of fluid in the sac, and that is coming from the yeast. So we have to teach our women how to take care of the reproductive system instead of losing it because it was created for a purpose. And a lot of women, when they lose it at a young age, they go through menopause prematurely. Boom, menopause comes in right away. Because some doctors will remove the uterus but also remove the ovaries at the same time. And when the ovaries are removed, that's it. They have no lubrication, cannot enjoy sex, and those things are problematic. So we have to teach our women how to do that. So I think our program on next time we're going to be dealing with women's health in terms of how to prevent PCOS, polycystic ovarian syndrome, ovarian cysts on the ovaries, and we're going to talk about how to prevent fibroids, and if they're there, what a woman can do to remove them naturally, because they hear the doctor saying to them you can't take it out naturally. That's not true. Only surgery, that's not true. Surgery is not always the best choice, you know what I'm saying?
Yeah.
So there are also things that we use to help to increase what we call uterine circulation, and once the circulation is increased, then everything starts shrinking. Okay, so we're going to talk about that now, and we're going to have a woman helping them to save the uterus, because a lot of them are losing the uterus is at 32, 35. You know what I'm saying?
Yeah.
Young ages too. And then, excuse me, a lot of women come in with ovarian cancer. They come in with ovarian cancer, some coming down with uterine cancer, cervical cancer. These are conditions that affects a lot of our women. So we have to deal with these issues. Otherwise, we will lose a lot of our women to these troubles. Okay?
Yeah.
But today we want to talk about the GI tract problems, diseases of the GI tract. And the GI tract means the large bowel, part of the stomach area, the duodenum, and the small intestines.
So that's the pathway that the food takes from the mouth to the esophagus, the stomach, and small and large intestine.
And that's so the duodenum is the beginning of the small intestine. That's where your food goes and the food starts to digest.
Right.
Finish the digestive process there. And then the small intestine is going to take out all the nutrients from the food and send it to the portal vessel, so your liver could feed it to your tissues and your cells. Let me just show you a picture of the GI tract so people can understand what it's all about. Yeah, okay. It's a picture of the GI tract right here. So this is the small intestine right here. Yeah? It's a large one. See the big one right here? See that big one here? Him? Diseases start right there. All diseases.
Yeah.
All. And lots of people have troubles down there. So let me name a few of the troubles that they have there. One is called Crohn's disease. That one is more difficult to fix, and that one could kill you. That's the worst one in all of them. Crohn's disease, and when you have Crohn's disease, you start to malabsorb. You can't absorb nothing in the tract. See, in the intestines, in the GI tract. Once you cannot absorb, you lose weight. And when you don't lose weight, you start to suffer from malnutrition. Malnutrition, death. See what I'm saying? So that's one condition of the GI tract. It's called Crohn's disease. Difficult to fix that one. That's the most difficult one to repair.
I haven't heard about it much of that. How prevalent is that?
A lot of people have it. It is very prevalent in North America.
Okay.
but we have a few people here who have it, that I know who have it. And there was a brother who ran a company from things in California. He had it, and he fixed it with Chinese medicine, Chinese herbs. So that's what we try to do. We use herbs of Chinese origin and also Western herbs, and also Caribbean plants to help to fix that condition. Yeah, it can be fixed. I'm going to show you how to fix it. Another condition of the GI tract is ileitis, and all these conditions are what we call inflammation of the GI tract. Yeah, once you hear itis, that's inflammation. Sinusitis, rhinitis, you know what I mean? All inflammation. Ileitis is another condition there. Then you have another one called diverticulitis, and that condition is when people have a stool that get caught in the pockets of the diverticula, and the stool stays there and rotten and cause that part of the colon to become inflamed. So they call it diverticulitis or diverticulosis, and that's another condition again that is affecting the GI tract or the colon, and cause one part of the colon, which is the diverticula, to become inflamed. Older people seem to have that one because of the not having the muscle contraction to move the waste out. Some of the waste gets stuck in the diverticula. All right, so that's another condition there. Then you have another one called ulcerative colitis. That's another trouble in the GI tract again. And ulcerative colitis again is inflammation, but now it's the ulcer. And also the sore. So you can have a sore external ulcer, and you can have an internal ulcer, because ulcer can enter the system also. Now in the ulcer, you could either have the ulcer in the duodenum, or you can have that ulcer in the large bowel. And once you have an ulcer, cancer develops too. Ulcer leads to cancer. If the ulcer is more up in the GI tract, meaning a little bit into the passage that leads into the small intestines, then you have to alkaline that area, because everything with alkalines a pH of 7.8, right? Now once the ulcer is there, that could create what we call the pylori bacteria, and the pylori bacteria is the main cause of stomach cancer. So from the GI tract, if that ulcer moves up, it can also disturb the function of the stomach, which is the earth, and then cause you to have or create the pylori bacteria, and then cancer develops there, right? If it's in the bowels, in the large bowel that is, let me show it again. Any part of this area over here, yeah? If the ulcer is in the bowels, the ulcer could also cause you to have blood in the stool, because it's going to bleed.
Yeah.
That's number one. Number two, it can also cause cancer in the colon, and cancer in the colon is on the rise. Not only in Grenada, brother, all over the world, because people they're not taking care of the bowels of the GI tract. Now, another condition is called mucus colitis. So you have ulcerative colitis and you have mucus colitis. And the mucus colitis now is what? Mucus. And when you have mucus colitis, it's because now you're not moving the foods well, and bacteria develops. So remember that you have trillions of bacteria in the bowels, in your colon. And they're supposed to do what? Protect us. They're supposed to make a B12 vitamin. And even when you're having a bowel movement, they're working for you also. That's the good guys. Trillions of them. And you have 80% of your immune cells is in there, in the sewage system, because that is where all diseases develops. So once you have mucus colitis, Mike, hear what happens now. You're not moving the bowels well. You cause a traffic jam between the stomach, the small intestines, and the large intestines, and then you start to have a certain amount of bad bacteria start to develop. Once these bad bacteria develop in the bowels, in the large colon, that is, in the large intestines, what happens is now the bad bacteria overtake the good bacteria, and once that happens, you get a few symptoms. One of the symptoms is bloating. That's a symptom of bad bacteria. And why the bloating? And next symptom again is bigorigamus. We call it intestinal rumbling. You start to get the belly start to make a lot of noise. Some people say, I'm hungry. That's not hungry. That's bacteria blowing bubbles. That's what it is. You're hungry.
Yeah, well, for years we've known that you're hungry. Because when you don't eat, that's when you're likely to have that sort of thing.
Well, you see, and that's a misconception again about gas. When you eat and the food moves from the stomach to the intestine, it must create a small amount of gases. That is common sense. Must. Because of the time it takes from the stomach to your intestines. See what I'm saying? Now, if it takes a longer time, the food that is, because it is not compatible together, meaning that you're combining your foods the wrong way, and you create a traffic jam from the stomach, which is the earth, to the GI tract, which is the earth, then you start to create more gases because it's taking a longer time. It's just like when you put a piece of meat outside for 3 days, what happens to it? It starts to bubble, right? It starts to form gases, start to smell. Same thing happens in your bowels, in the sewage system, in your large intestines. The food takes so long to move from the stomach to the GI tract because you're combining them wrong. So they slow up each other. And once the movement slows up, you start to create bacteria in your bowels, excessive amount of the bad ones. And then they start to blow bubbles for you. And then you start to get bloatedness. And you start to get bigorigomus, intestinal rumbling. And what happens to them now is, they go into your mucous membranes in the bowels. Let me show you where they are. Mucous membranes is right here. All in here is mucous membranes. This is the passage. And this is where the mucous membranes is at. So the bad bacteria now wants to invade your mucous membranes. But your mucous membranes have a protection. And the protection is what? Mucus. So once the mucous membranes see the bacteria start coming in, they say, oh shoot, too much bacteria, bad guys. So the mucous membranes start to produce excessive amount of mucus. That's good because it is protecting the mucous membranes, but that's bad too because you start to get mucus colitis. You see mucus in your stool. So the doctors call it mucus colitis, but they can't fix it because they know how. That's another condition, mucus colitis. So mucus colitis is caused by a excessive amount of bacteria in the bowels because of slow movement of the foods moving from the stomach to your intestines. And once the bacteria invade the mucous membranes, the mucous membrane will protect itself by producing excessive amount of mucus to protect it. And then what happens is you start to see cold in your stool. So when you go to the bathroom, there's a lot of cold there. Mucus, they call it. So they call it mucus colitis. There's another one called IBS, irritable bowel syndrome, or they call it leaky gut. That's another problem again in the GI tract. That one is more difficult too because it puts holes in your intestines, in the small intestine that is. And it's difficult to fix that because now, once you have IBS, once you have allergies, sorry, I send you to a doctor. I said, go to your doctor and ask your doctor to do a test for an enzyme in your intestines to see if you have IBS. Because lots of people who have IBS get allergies. So once you have allergies, I said to you, you look at you have IBS. Because IBS is leaky gut, whereby you eat the foods in chunks, you don't chew properly, you call it cut and swallow. You know this is the ingredient, man. You have a spoon of food in the mouth and you still put another one.
Yeah.
You know what I'm saying? Right. And he chewing properly, and then he talk when he eats too. And when he swallow, he don't swallow properly. He don't chew the foods well. So the foods get into the GI tract, and the foods start to put holes in the small intestine. This one over here. Small intestine right there. This one right there. See there? Right. Once the food start putting holes because you don't chew it properly, your immune system, which not supposed to break down your foods, is supposed to what? Protect you from yeast, fungi, viruses, cancer cells, and parasites. He start to take your foods now that leak through your gut as other foreign invader. And once you start to have your immune system attacking your food particles, because your food not supposed to be broken down by your immune system, your food supposed to be broken down by what? Enzymes from the pancreas. But your immune system see these foods coming back out in the gut because they have holes in there, and it starts shooting these fires, start to fire the foreign invaders. And use Nike start to get start to get allergies. And that's where allergies come from. So we call allergies an immune response, an autoimmune disease. That's what we call allergies, because it is coming from the earth, which is your GI tract. So those are the conditions of the GI tract. And you have indigestion, you have dysbiosis, you have hiatus hernia, you have GERD, they call it GERD, gastrointestinal reflux disorder. They call it a disease. You have acid coming back. And all these conditions is coming from where? Right there. Right in the GI tract. That's where it is. See? So, and why the condition starts there? Because in the GI tract, there is a pH of 7.8, alkaline. But when we eat the foods in an incompatible way, meaning that we're going to be eating starches with proteins together, and once you eat that way, you slow up the movement of your foods. And once your foods get into your intestines, you eat 3 meals per day, and you go to the bathroom once per day. The other 2 meals are still there. And once they're there, they are fermenting. And once they are fermenting, they are creating what we call putrefaction. And once the putrefaction starts there, it starts to change the pH in your intestines to an acid terrain. And once acid becomes prevalent in your intestinal tract, it burns up the colon walls and causes you to have ulcers inside there. And then your ulcer leads to cancer. And then you become constipated. You can't go to the bathroom well. And then you develop tumors in there. And then the tumors move from there and it goes straight away to your liver. So now we're going to teach people now today how to use the herbs to keep inside it healthy.
Interesting.
You understand?
Right, because that would be an interesting thing in terms of how do you keep it healthy?
The first thing people have to learn is to have the foods moving from one place to the next the exact time. It's a common sense thing. You don't have to be educated to understand these basic principles. You have to have things moving, because if you, Mikey, you know on a Friday what happened in Grenada in town, traffic is like crazy. And you in traffic, Mikey, what happens to you? Tell me what happens to you in traffic.
You get impatient.
And you start to do what? Just like in Manhattan.
You're honking?
You're honking your horn. Because anybody who lives in New York will tell you that. Traffic is crazy in Manhattan, or especially on 5th Avenue. And once you're in traffic, you see, you always hear a horn blowing. Because people become agitated and aggravated because they can't wait. Now, same exact principle in your intestines. Once you create a traffic jam in there, your food won't start to can't move and cause a traffic jam. And then you want to start to have troubles long term. And especially when you are going to bed with them foods sitting in your belly, not being digested. That's where all the diseases start. So if the person comes to me and they have what we call Crohn's disease, they have ileitis, they have diabetic colitis, they have mucus colitis. Now mucus colitis is totally different. We have to work with a few different plants. But if we go into let's go with ulcerative colitis. If you come to me and have an ulcer in the stomach or in the GI tract, there are plants that we use that we call the Mulson plants. And there are plants that we use that we call astringent plants. So once you have any kind of problem in the GI tract, you must use astringent plants and you must use the Mulson plants. So let's look at what are the Mulson plants is right here. And you have to use the carminatives, right? And the carminative plants are like chamomile. And if you have, all right, look at over here. Now, this is what we call the Mulson plant. See right here? It's called marshmallow. So marshmallow is an emulsion plant. Slippery elm is an emulsion plant. Sea moss is an emulsion plant because they have mucilage. They could become sticky. So the purpose of these plants, when we go into the GI tract to fix an ulcer, is to soothe the ulcer. So when the herbs go in there, if the ulcer is there, they're soothed because of the mucilage content of the herbs. They start soothing the ulcers so they could fix it. And then you can't go, Mikey, and eat no foods that will irritate the ulcer because you are repairing it. So anyone who is listening to your program supposed to know that once you have troubles in the GI tract with ulcers, you have to use liquids. And you can't use nothing with pepper. It's going to burn the ulcer. And you can't use nothing with acid, because you're looking to alkaline the pH back into your intestines to get back the normal function of that particular organ. That's one herb we use. Another herb we use again is called, we could use golden seal, we can use Oregon grapefruit, we can use barberry, because they have the same amount of chemicals or compounds called berberine. Golden seal, if it's a long-term program, because usually when you're doing a GI tract repair, it takes about 2 to 3 months to fix it. And if it's a 2-month program or 3-month program, we have to eliminate the golden seal, because golden seal is an antibacterial plant, and it will kill the bacteria in your bowels. So we remove that plant and we put in some barberry or some Oregon grapefruit. Don't forget that now. And then we use 40 billion of the good bacteria to force out the bad guys that is causing you to have havoc in that area. That's the second herb we use. And golden seed is what we call an astringent plant. And what the astringent plant do? They help to normalize the tissue of the colon walls. They help to normalize any tissue of the body. That's what astringent plant does. Now, if the person have the nerves in the stomach or in the intestine that are giving them troubles, we use what we call the carminatives. And the carminatives are plants that help to calm the stomach walls and calm the nerves in the stomach. So we're going to use a herb by the name of chamomile. This one right here. And we're going to go by parts. So we're going to put it in parts for you if you have a little bit of time. And then again, if there is inflammation in the bowels, because all these conditions, ileitis, all the itis is inflammation, we have to do what? Use anti-inflammatories. So we use what? We use wild yam. We use turmeric in there. Those are anti-inflammatories. If there is bleeding in the bowels because of the ulcer, we go to the plants that stops bleeding. Yarrow. So you see what I'm saying? So it's a combination of plants we use to do different things. See?
And all these plants are found locally?
Locally? Some of them, not all of them, man.
Okay.
But I bring them in, you know?
Yeah.
And so if there is bleeding, we use the yarrow for there. If there is any kind of endotoxins in the gut, we use a herb called sarsaparilla. Right here. This one right here, sarsaparilla. Yeah? If the stomach is inflamed and there is fever from the condition in the GI tract, we use a herb called catnip or peppermint. If there is this catnip right here, and if there is no sweating, and we want to increase the movement of sweat in terms of the 8-method therapy, we use the diaphoretic plants. Diaphoretic plants means that they help you to sweat. Right? If there is an ulcer in the stomach, and we want to go out and work on the esophagus now, because some people have what we call a short esophagus. And why they have a short esophagus? Because they have a hiatus hernia. Because the stomach is so messed up that the stomach pushes up right over here. See it? And it touches the hiatus. And or long term, X-rays don't really pick it up. So a person starts to have what we call a short esophagus. So when they eat, they start to get pain right here because the stomach is up. What I do, I will put them down on the bed, put their hand on the side, and I will feel right over here. And I say, oh, your stomach is up in your esophagus, in your esophagus. It's touching your hiatus. And if it touches your hiatus, it's going to affect your diaphragm. You can't breathe well. So I push it back down. Whoop! Do a technique and I push it back down. Push the stomach back down. And then the esophagus comes back to normal size. See what I'm saying to you? And then they start to eat better. See? So once you have these conditions, we're looking at plants that work together. So if you have, say you have ulcerative colitis, the main herb there should be slippery end. The main herb. Because the ulcer you have. And you should use 6 parts. 6 parts mean you're using 6 tablespoons of the plant, of the herb. In a bag, empty bag. Yeah? So you're using 6 parts means you're using 6 parts in a bag, of the slippery, that's the main herb. Then you have what we call this assistant plants. So the plants that is assisting what the main herb is doing to the ulcer. You see what I'm saying to you? So you use about 4 parts of those, and the assistant herb can be wild yam because it's inflammation. So the assistant herb is 4 parts, 4 tablespoons. Then you can use 2 herbs or 3 herbs that assist the main herb, and you could use wild yam, other assistant plant, 4 parts, which is 4 tablespoons. You can use another herb they call turmeric, which is 4 parts, with another inflammatory plant. And you can use a astringent plant. You can use 2 parts of that. 2 parts is 2 tablespoons. And the astringent plant should be either your barberry or your golden seal or your Oregon grapefruit. 2 parts. And they are what we call the supporting herbs. You follow what I'm saying to you? So herbal medicine is not what people think it is. Let's go and boil herb and drink it. You have to go to a herbalist. See? So 6 parts, 4 parts, which is the assistant herbs, and then you have the 2 parts of maybe 2 or 3 herbs, which is supporting what the other herbs are doing. So while some herbs are soothing the ulcers, some herbs are working on the tissues. While some herbs are working on the tissues, some herbs stopping the bleeding. While some herbs stopping the bleeding, some herbs are stopping the nerve from being overactive. So the calming is coming down, and it's calming the GI tract.
So it's a well calculated combination of
man,
to achieve whatever you want.
Yes, my brother.
Okay, and some people may hear of certain herbs that may be good for this and good for that, but if taken in isolation, probably you may be creating another problem.
Well, I don't understand what you mean by that. Explain it to me again.
Okay, you may be probably you have bleeding, and you just take that one herb that is good to stop the bleeding.
I got you.
But taken in isolation, just that can be creating another problem within the system.
That's very true, and that's why we use herbs and plants. I'm going to give you a good example. There's a herb called comfrey, and there's a herb called chaparral. There's a herb called bitter burr, and they have what we call compounds that they call alkaloids, and these herbs have what we call pearlizidine alkaloids. So as you said, if you use these particular herbs in a single form for a long period of time, they will cause you to get venereal-occlusive disease of your liver.
Right.
So I can't have it. That's one herb. But if you mix these herbs with other plants, the compounds of the other plants will cut down the side effect of that particular herb.
Right.
That's another good example of licorice. Licorice is the herb that we make you retain sodium. Although it's a herb for the glands, and it's a wonderful herb for the stomach and the lungs, but it also makes you retain sodium because of the compound in there. See? But if you mix the licorice with, say, hawthorn leaf flower, with mistletoe, with yarrow, you know what I mean, with ginkgo, that side effect of retaining sodium disappears because these other herbs move it out. So that's why we use formulas. We don't use one single plant.
Right.
We use herbs and formulas. So for instance, if you're going to shrink a man's prostate gland, yeah, the man's prostate gland is enlarged, we can use one herb to shrink it, which is not saw palmetto, but saw palmetto in terms of preventing the 5-alpha reductase from converting into dihydrotestosterone, it won't be as effective as if we use saw palmetto, butchu leaves, you know what I'm saying? Hydrangea, nettle root to shrink the prostate, white sage, and collinsonia, because they do different things to the prostate. They do different things to the gland, to that particular gland, and they do different things to the veins. So for instance, the collinsonia in the mixture will help to strengthen the veins, so you have what we call vascular integrity. So herbs in combination is much better than using one herb alone.
In isolation.
Yes.
Now, let's talk about briefly. We have about 4 more minutes.
Yes,
so
we do.
How do we keep the foods moving within the GI tract?
That's a good question. In Grenada, in North America, people eat starches and proteins at the same time. Bad habit, because that's what we were taught. And then they taught us here about the pyramid diet. What is the pyramid diet? A pyramid diet is a disease diet. That's what the dietitians promote. A pyramid diet. What is it? You must have all the 6 food groups in your plate. Or say, oh yeah, how come? Why? If you are a dietitian when it's school to be a dietitian, you come and tell me that means you have to go to school, because you can never tell me that a pyramid diet will keep you well, because a pyramid diet is the acid diet. All the food groups in one plate. So in Grenada, how we eat is, we eat all the starches, which are acids, all the proteins, which are acids together, all the fats, which are acids together. They're all acids. And then we put a small amount of green leafy things, which is more alkaline. And the body functions in an alkaline system. So we eat and start with a protein. Now when you eat a piece of yam, Mikey, you keep the yam in your mouth for 2 minutes. What happens to the yam? Turn to sugar. Because the enzyme in your saliva start breaking on the sugar chain from the yam already. All starches. See? When that yam, after you chew the yam, and the yam gets into your stomach, it can never stay. Because the acid that your stomach produces kills the enzyme that breaks down the yam, so the yam can't stay, or the potato can't stay, or the rice can't stay, the macaroni can't stay. They can't. They move. And they move into your small intestines, where your pancreas and your small intestines start to secrete a little bit more of that enzyme to finish the digestive process of all your starches. So starches do not digest in your stomach. See what I'm saying to you? Are you to follow me now?
Yeah.
You eat a piece of chicken, pork, beef, fish, turkey. They're all protein, they're all acid foods too. And they take long to digest. When they get into your stomach, the acid kills the protease that breaks down the protein in your fish, chicken, beef, pork, or turkey. But the protein have a backup called pectin that resists the acid. So all your protein foods digest in your stomach. Hear what happens to you when you eat them together now. And fats. You eat potatoes, macaroni, rice, eat them with a piece of fish. When they get into the stomach together, guess what happens? The fish slows up the yam and the potato. It can't move. Because the yam and the potato do not digest in your stomach. They don't. But through the fish digest there, he have to wait for that fish to digest before he moves. And if the fish take 12 hours to digest in your stomach, that yam, that potato, that rice going to stay in your stomach for 12 hours. And while he's waiting and being idle, he starts to create what? Fermentation. And fermentation in turn causes what? Acids. And once the body becomes too acidic, you have a problem. So once the fish digests, then your starch moves, and he moves undigested and finishes the digestive process in your small intestine. The only problem is that fish is still in your stomach, can't go. So now you slow up the fish and cause the fish to stay in there for another 8 hours. So when you go to the bathroom, you must pray, because your stool smell, because you start to have putrefaction, because you combine wrong. So when they come and tell me about the pyramid diet, I say, the pyramid diet, what's that? That's a disease diet. That's an acid diet. So when a dietitian comes to me and say, you have to have all 6 food groups in your plate, I say, oh yeah. So when you have all the 6 food groups in your plate, you are sending conflicting messages to the enzymes. And they don't know which one to break down first. And once that happens, you start to have indigestion, you start to have gases, you start to have bad bacteria developing, you start to have trouble in the esophagus, you start to have burning in the heart, you start to have Crohn's disease, you start to have IBS, you start to have ileitis, Crohn's disease, ileitis, diverticulitis, mucus colitis, and all these other inflammatory diseases of the GI tract, because you were combining wrong. But once you could eat the foods, a vegetable with a protein, the vegetable will buffer it, and then the body stays alkaline, and the food moves. And if you eat 3 meals per day, you will have 3 bowel movements per day, brother. Eating that way. So before we go, if you're taking 15,000 milligrams of vitamin C per day, now that's what I give all my cancer patients. I give my cancer patients 15,000 milligrams of vitamin C per day. But here's what I do with the vitamin C. Because vitamin C is an acid vitamin and can irritate your kidney in maximum amount, I buffer it with what? With calcium, magnesium, and potassium, because they're buffering agents. Once the magnesium and the calcium get in there with the vitamin C, guess what they do? They change the composition of the acid pH of the vitamin C vitamin, and they turn it into a pH of 7.0 because they buffer it. So you have to buffer when you eat your foods in your stomach and have what we call fast transit time. And once your transit time is fast, you will prevent the disease, because all diseases starts in the earth. And the earth, like the earth right there. That's the earth. This is the earth. And if you eat wrong for a long period of time, all this here, supposed to be fat, won't come like that. See them over here? And then you're going to have troubles going to the bathroom. Your stool going to become thin, but you're supposed to have a fat stool like that. And you go to the bathroom, brother. Yeah. Bless and love.
All right.
Give thanks and praise to the Most High.
Folks, Patrick Dells, Herbalist. Patrick Dells, talking about the GI tract, and how you can speed up the process of digestion and so on by combining the food the way he took it.
That's why we're so sick. We combine it wrong. And we want to blame it on genes. Not your genes. You have a genetic predisposition. That's what it is. Bless and love, Mikey. Give thanks, eh?
Always.
All right. Bye.
Alright folks, thanks for watching, and you can check out Patrick Dells' page. It's Patrick Dells. He has a lot of other very interesting discussions there. And also check out Patrick Dells on his page, and don't forget to also share the stream. Alright, like, love, and share the stream. Yeah, let other people see the program. Alright. Alright, so they say thank you, Patrick.
Listen, look.
What if somebody wants to contact you? What's your what?
473-416-2310.
Alright folks, so that's it right there, and thank you again for watching. We're gonna have another program for you next Thursday, God's willing. So bless side. Don't forget, like, love, and share.
And the one next Thursday is for women.
And the one next Thursday is for women, and men, you have to be there too, because you want to know what's good for you, woman. Alright.